Early in the year, I wanted to show what the coronavirus was doing to the United States, and I wanted to travel as safely as possible. It is redundant to say, but really, no one alive has ever suffered through a prolonged period like this. When the virus first cropped up here last March, we drove to a small Kentucky town. It had the first outbreak in that state, and it is hard to describe how weird everything was at that time. People were on lockdown. The roads were completely empty. People were not out, and those who were terrified. They were scared of getting the disease, and they were terrified that the economy could not handle a prolonged outbreak. This is Cynthiana in Harrison County, Kentucky. Population 6,300. COVID-19 didn't strike first in a major city in the state. Instead, it hit here. Becky Barnes is editor of the Cynthiana Democrat and has worked here 44 years.
I've always felt like we were a compassionate community, and this has just brought all that home to me.
Take a look at all this butter and sugar. It's no surprise that Robert Vella's motto is "Don't trust a skinny chef." But you might consider it a surprise that this small-town restaurant is holding its own in the middle of a pandemic.
We thought for sure when the announcement came and that we were done. Our life dream, our retirement that we poured into this was all done, and this town said not today.
But that was really the calm before the storm. Hospitals started filling quickly, and doctors in many areas had to make very difficult decisions: who lives and who dies. That took us to New Orleans, Louisiana. Its hospitals were overflowing. We didn't know it at the time, but the city's annual Mardi Gras celebration became one of the first super spreaders in the United States. Dr. Eric George, a hospital administrator there, took me inside a COVID ICU ward to look at the struggle between life and death.
Dr. George, one thing that really stands out to me, we've seen a lot of images of empty streets and empty buildings and empty schools, but this is COVID-19.
This is it. And it's when you tell patients and you tell people out in the public to be cautious and be careful, this is a real disease. And if you don't take care of yourself, the young people who can transmit this to elderly or immunocompromised patients, and this is what you do to them.
Mostly, they try to make her comfortable. Breathing is labored, and pain medication comes as often as possible. What hurts the staff are demands to reopen the United States, to push for business as usual and make it happen now.
And all they need to do is spend a minute in this room. It is absolutely the most frustrating for all of us in healthcare. We say to ourselves, our nurses come and they say, I can't believe that people ask us, is this disease real?
If there is one thing that health officials said people can do to slow the spread of the virus, it's just by wearing a mask. I'll take you down memory lane to some of the masks that I had this year. I started out with a biggie, the N95. Then I kind of went to this hospital-esque mask that was really effective, before finally settling on a nice soft cotton mask that a lot of people in the United States are wearing. And now you can see masks with everything, especially those carrying a message these days. But one thing people in the United States really didn't see was Donald Trump wearing a mask. And many of his supporters followed suit. That took us to a biker bar in East Texas, where masks are optional. It isn't healthy, and it certainly isn't advised. Texas is a state known for its individualism, and the city of Kilgore, with its salute to oil and the prosperity it brought the state, is no exception. There's a feeling that when it comes to government, less is more, and that extends to mandates on coronavirus safety.
We are very, very proud individuals here in Texas, and to restrict what we can do, in my opinion, unconstitutionally, is not very many people are going to put up with it. To tell me that I can't do something, my first response is I'm a grown man, okay? I can read all the literature and I can form my own opinion.
The entire time, the U.S. death toll continues to climb. Once thought of as the world leader in fighting diseases, the U.S. now leads in a very grim category: the number of people who have died because of the coronavirus. The Trump administration has been widely criticized for failing to deal with the virus early on and the president's lack of empathy. I have seen no shortage of suffering driving around the country, and that took us to East Texas and a family where parents were fighting the virus for months, teetering between life and death.
I want everyone to be cautious and know that this is real, and you can get it like this.
Sheena's sister Hazel is young and healthy and recovered at home in rural Tyler, Texas. Their parents, however, faced weeks of doctors, nurses, pain medications, and tubes in intensive care. Sheena chiefly talked to her parents via FaceTime. Nurses held the phone, constantly informing Sheena of any change in condition.
I don't want you to give up, okay? I know you're thinking about giving up, and I know you're tired.
2020 has really been characterized by death and disruption. Really, there's nothing in the United States people can take for granted right now. Even simple pleasures like going out for dinner and drinks with their friends and weddings, all of that is on hold right now in an effort to stop the spread of the virus. And remember live music? Well, that's gone. And now there's a concern it will not be back in all of 2021. Even megastars like the Rolling Stones saw their world tour postponed. Well, we caught up with the Stones keyboard player Chuck Leavell at his home in the woods of southern Georgia.
Well, this has got to be one of the strangest things for me as a musician and artist to go through, that everything is shut. Nobody's working.
They can't always get what you want. On April 18th, the Rolling Stones did what they do best: rise to the occasion, playing one of their classics at the One World Together at Home show online to raise money for the World Health Organization.
But it can try sometime.
Well, as 2020 comes to a close, there is a feeling of good riddance. Eventually, we'll be able to look back at all of the lessons learned during the great pandemic. But right now, we can look forward with a hint of optimism for the first time in a long time. That's because the vaccine is starting to hit the market. However, health officials say it is going to be a long, painful road back. So far, I've been tested with nasal swabs for COVID-19 about 20 times. Each time, all negative. And with lots of stories out there, all I can do is keep my fingers crossed for the future. Sean Callebs, CGTN in Washington.